I've been wondering who are the people who work behind the aftermath of facial and oral surgery. Thanks to research, I finally know the surgeons that are behind this. In this healthcare display presentation, we now introduce oral and maxillofacial surgeons.
Both of these surgeons specialize in the cephalic part of the body and your neck. But to be specific, oral surgeons mostly handle injuries, diseases, or malformations in the mouth, teeth, and gums. But maxillofacial surgeons work on the head, jaw, neck, and sinuses.
Let's start off with their job responsibilities. Both surgeons administer local and general anesthetics. To determine a patient's needs and their treatment goals, they must analyze the patient data. To add on, they also perform surgery to arrange or prepare the mouth for dental implants and aid in the regeneration of deficiency of gum and bone tissue. In addition, they remove teeth that are damaged, impacted, or unrecoverable.
Additionally, they manage infected parts of the jaw, neck, oral cavity, and the salivary glands as well as removing tumors and unusual growth of regions in the mouth or on the face with the use of surgical instruments. Providing emergency care for facial injuries, intraoral and facial lacerations, and facial fractures are also a responsibility of both oral and maxillofacial surgeons. These surgeons also restate the form and function to reconstruct or overhaul the jaw and the face by operating on the skin, tissue, bone, and even nerves from different body parts.
Of course, successful oral and maxillofacial surgeons are required to pass the following educational requirements first. Oral and maxillofacial surgeons must have a pre-medical or a dental education. Oral and maxillofacial surgeons receive basic dental training, including a 4-year curriculum where students work towards a DDS, a Doctor of Dental Surgery degree. Last but not least, oral and maxillofacial surgeons are needed to complete a minimum of 4 years in a hospital-based surgical residency program. Most of these types of surgeons have an average of 12 to 14 years of schooling at a college level.
Now it's time for the good stuff, the moolah. With less than a 1-year experience, maxillofacial and oral surgeons are expected to earn an average salary or compensation of $216,734, including bonuses, overtime pay, and tips. Early career oral and maxillofacial surgeons earn a payment of $218,380 with at least 1 to 4 years of experience. Mid-career oral and maxillofacial surgeons earn a compensation of $252,856 with 5 to 9 years of experience. Then, experienced oral and maxillofacial surgeons earn a compensation of $271,241 with 10 to 9 years of experience. And lastly, late career oral and maxillofacial surgeons earn a compensation of $250,252 with 20 or more years of experience.
We know with success there's always some obstacle in life, just like how these surgeons go through extensive education and extremely thorough testing. Another challenge is that you can't immediately begin your career in oral surgery by embarking into dentistry. As an oral and maxillofacial surgeon, the market is extremely competitive and stressful.
Despite every challenge these surgeons face, there are also benefits. For instance, as an oral and maxillofacial surgeon, you can achieve long-term tooth replacement, prevent significant injury, and these surgeons address the problem, but not just the symptoms.
Since we're nearing the end of our presentation, we will provide you with some extra information about these notable and skilled surgeons. Based on all the information in this presentation, you already know the responsibilities oral and maxillofacial surgeons have. They perform facial reconstruction and outright restoring surgery to increase aesthetics and purpose.
Maxillo and oral surgery provide extensive applications, for example, head and neck cancers, facial pain and disproportion, TJ or temporomandibular joint disorders, salivary glands that consist of disease or diseases, and so much problems that influence the oral mucosa. These surgeons work in a distinctive medical field.
Oral and maxillofacial surgeons play such an important role in the medical field.
That's me. And that's a wrap.
Stand up to be a leader just like oral and maxillofacial surgeons.
Thank you.